The presentation that I am doing half of today is called Mud, Muck, and Yuck, Sensory and the Young Child. This is by Abigail, Molly, and myself. This was our project. We wanted to concentrate on sensory because it is the first way a child gets to learn. And when we look a little bit deeper, it's really everything that we take in as knowledge or how we do something. It is all through sensory. So there's a developmental association or therapy that says all information we receive from the world comes to us through our sensory systems. And if you stop and think about it, there's no other way. I mean, we either see it or taste it or smell it or hear it and we have to make sure we remember the other things that are really sensory. Our nervous system, our balance, and our movements and our positions, and all of those things are also part of our sensory systems. And those things are very important. If we do not help children integrate like both sides of the brain and help them figure out sensory and figure out how things work, they will not develop. Normally, they will really struggle with some things. And some children are already sensory avoidant, so we have to be real careful with them. We want to make it better, but we don't want to overwhelm them, and then things are not good for them. And we might ruin how they learn. So, as many of us already know, learning begins before birth. They know the mom's voice. They know other voices as well, but they know mom's better, even though it sounds like they're underwater. That baby comes out knowing who she is, even though she doesn't sound like she's underwater anymore. They can taste and smell what mom is feeding herself. They feel pain. And to me, one of the most important things that they feel is they can feel the stress of the mother's environment. They can feel all of these and do all of these things before the gestational month 7. The part about feeling the stress and joys of the mother can already set them on a rough path for even sensory. And it literally begins that cycle of toxic stress. So when we have moms under unbelievable stress for one reason or another, there's a million reasons. It could just be stress because she's pregnant and she's scared. We need to help them, and that is our job as early educators, to also help the families. We're taking care of a toddler, but mom's having another baby and she doesn't know what to do with 2 babies. This can be very stressful and can affect that infant that she's carrying, along with the horrible things that somebody can be stressing about. So that is why we want those cute little beings to come out and just get filthy dirty. It's just it's important. I don't really like mud, but they do, and they should have it, and we should work on that with them. The other thing is when a child plays in the mud, he is using almost all of his senses. He is feeling the squishy and the soft stuff. He is learning temperature, texture, wet and dry. And on top of that, he is learning the very first skills of learning to write. Moms and dads don't see that. They just see it as a mess. So that is also something we need to help with them. And they also need to know that their toddler can help clean it up as well. So although they're learning and experimenting, that mess isn't all for mom to clean up, because toddlers are very capable people. They're more capable than you'll know until you help them. There's all kinds of stages that you're bringing up your babies that are very stressful. They crawl and stuff, they bite stuff, they feel stuff, all those things. And that one thing, the never-ending stage of putting things in their mouth, if we step back, we can not despair. Do not despair. They are learning. They are learning the use of their oral senses, but think about, on top of that, they're learning how to shake that rattle. They're learning how to move that gadget. They're learning how to move to get the gadget that they want to put in their mouth or piece of string. Of course, we have to obviously keep them safe, but they are going to be putting stuff in their mouth all the time. this is how they discover the world. So we should have things available for babies and young toddlers to mouth. You've got a toddler that's biting, she's telling you she needs to bite. So you need to find something that's appropriate for her to bite. An apple, a carrot, an IV tube we've had them chew on. It's our job as educators to help them foster these skills. They're born with these skills. Our largest job is to provide the opportunities for young children to learn how to use their body. And when they learn how to use their body, then they learn how they can read, and then they learn how to walk, then they get to learn how they talk. And that's just amazes me, sensory does, and how you can put it in just about your whole classroom, especially with toddlers. Molly will go through our lesson plan in a little bit, and Abigail will pick up from where I have left off about the wonderful little things that sensories can help with.